This is from the San Francisco Chronicle. How a crackdown on opioids is leaving patients in agonizing pain. People with chronic pain say it's increasingly difficult to get prescription opiates.
Words bubble out of Lori Long, evincing her natural exuberance, but the 51-year-old has been put to the test by debilitating pain. An autoimmune disease inflames her joints and ligaments, forcing her body to curve forward. Since age 15, she's had about 20 major surgeries on her spine and other affected organs. The inflammation and after effects of surgery leave her in constant pain, which she has managed with prescription opioids. For me, pain medication was really life-saving, she said. It allowed me to function and to do more things I would not be able to do without it. Everyday things, like taking a bath, doing my hair, putting on some makeup. She uses the past tense when she talks about her pain meds now. Although she still has a prescription, after several periods of months and even years when she lost access altogether, Long said the doses she is now allowed are much lower than she needs. I've regained some of my function, but I still can't participate in life the way I did when I had better pain relief, she said. People have sought relief from pain for millennia, trying solutions from gnawing on willow bark to smoking poppy seeds. Opioids, which were first derived from poppies by ancient civilizations and now can be made synthetically, are among the most potent pain reliever. But they are also highly addictive. Their use and abuse spun out of control in the late 1990s and early 2000s as pharmaceutical companies aggressively promoted them and doctors increasingly prescribed them. That ignited a crisis of addiction and overdose deaths. In recent years, the U.S. has cracked down on all opioid prescriptions, seeking to stem the crisis. The result, according to many patients, physicians, and advocates, is that the doctors are afraid to prescribe and pharmacists are reluctant to dispense opioids while supplies are limited. Countless vulnerable patients denied medication they say is vital to their well-being have endured needless suffering and even death. And one telling aspect of the situation, Kaiser Permanente, the giant health maintenance organization, is sending letters to its patients on opioids, warning that their treatments will come under scrutiny. It's very clear that some of the unintended consequences of those proscriptive opioid policies ended up harming patients who are taking opioids appropriately for legitimate circumstances and were experiencing reductions in pain and improvements in life and physical functioning, said Dr. Sean Mackey, chief of the Division of Pain Medicine at Stanford. At least 50 million Americans live with chronic pain, according to the Centers for Disease Control and Prevention, while millions more have temporary pain after surgeries or accidents. About 5 million to 8 million rely on opioid medications to deal with the pain. But after years in which doctors overprescribed opioids and some patients ended up hooked on painkillers, the U.S. has drastically limited prescription opioids in several ways. The CDC issued new opioid guidelines in 2016 that capped the amounts doctors could prescribe. State legislators and state medical boards passed their own laws and regulations enshrining the CDC's lower limits. The Drug Enforcement Administration, which oversees the manufacture of controlled substances, lowered quotas for annual production of opioids. Since 2013, it has reduced the supply of oxycodone by 65% and that of hydrocodone by 73%. Jesus fucking Christ, dude.
Yep.
The DEA and other law enforcement agencies raided doctors who wrote too many prescriptions above the CDC threshold. Some doctors were hit with fines, license revocation, seizure of assets, and prison sentences. Meanwhile, their patients were cut off from their medications. Federal, state, and local governments sued pharmaceutical companies and drugstores, including Walmart, Rite Aid, Walgreens, and CVS. Most cases have been settled, often for billions of dollars, along with agreements to further rein in opioid production and add extra scrutiny to prescriptions. And they start by not having enough people to fucking work there. But the impact on the opioid crisis seems negligible. While annual opioid prescriptions nationwide fell 44% from 2012 to 2020, according to CDC data, drug overdoses from prescription opioids barely budged, going from 17,029 in 2017 to 16,706 in 2021, according to National Institutes on Drug Abuse Analysis of CDC data. Meanwhile, drug overdoses from the synthetic opioid fentanyl soared from 28,466 in 2017 to 70,601 in 2021, according to the same data. Illegal street fentanyl, increasingly potent and lethal, is the main culprit. The policy assumption was that if you cut access to medical supply of prescription opioids, overdoses would go down, said Kate Nicholson, executive director of the National Pain Advocacy Center, which advocates for the rights of people living in pain. Actually, they've doubled because the response of the market has been to go to illicit fentanyl, which is more dangerous. Sacramento physician Dr. Lee Snook has been practicing pain management medicine since 1987. He entered the field by accident, starting as a hospital anesthesiologist. Sometimes oncologists would refer end-of-life cancer patients with intractable pain for him to treat with anesthesia techniques like epidural catheter injecting morphine. We would do things to help manage their pain, and lo and behold, a number of them were suddenly living 2 or 3 years. That's where I learned that pain kills. Inadequate pain management kills. Alleviating pain is a basic question of humanity, he said. If you can't help patients who need medication management for pain, you're driving them to the street to seek illegal drugs or reducing their quality of life and shortening their duration of life. Treating his patients is a lot harder in the new climate. Due to the restrictions, he has had to taper or reduce doses for patients who had long-term stability. Some have endured adverse consequences, such as serious withdrawal symptoms and even suicide. We're dealing with patients who oftentimes don't have any other recourse, he said. If we have medications we can provide to help relieve the effects of their injuries or chronic pain, we should be able to do that and not fear prosecution. Many doctors are so fearful of a crackdown by authorities that they turn away patients who are taking prescribed opioids for intractable pain. Lori Long, the woman living with chronic pain, lost medication support and continuity of care for almost 2 years after her doctor died. As she sought a new physician, I was treated like a leper from biblical times, she said. No one wanted to touch me, treat me, or give me care. I had doctors tell me, if you only had a cancer diagnosis, I could help you. At 2 separate times, she found a new doctor, but both soon decided that they could no longer practice pain medicine under the onerous restrictions. Eventually, she did find a physician to help manage her pain, albeit at much lower doses than she had before. In a 2019 study published in the journal Pain, researchers from the University of Michigan contacted 452 primary care clinics in 9 states, posing as patients taking opioids for chronic pain whose previous doctors had either retired or stopped prescribing opioids. Only 32% of the clinics said they might accept the patients and continue prescribing their painkillers, while 43% said they would not. The clinics were more likely to accept patients whose doctors had retired. These findings suggest that primary care access is limited for patients taking opioids for chronic pain, the researchers wrote. Bev Schechtman, vice president of the Doctor-Patient Forum, an advocacy group, put it more bluntly. They're like medical orphans, she said, of patients whose doctors can't or won't prescribe for them any longer. There's nowhere for them to go. Barriers exist for people who need opioids for short-term use after surgeries or trauma, as well as for those with long-term pain. At 77, Patricia McCormick of Oakland, a retired school psychologist, has had plenty of surgeries, including knee and shoulder replacements. She experienced a huge difference in the pain meds she's been offered post-surgery in recent years compared to the past. In 2015, after battling pancreatic cancer, she had a Whipple surgery to remove part of the pancreas, small intestines, gallbladder, and bile duct, and then rearrange the remaining organs. It is notorious for being an extremely painful procedure. When I went home, they didn't give me enough medication, and I was in agony, she said. I'm old, for God's sake, she said. Give old people a break. Just give us pain medication. Monitor it. Fine, I'm not an addict. You shouldn't have to be in pain in this day and age. As physicians and patients have pushed back, the pendulum is starting to swing from overly harsh rules, but it hasn't yet resulted in a more welcoming climate. Among the changes, a unanimous Supreme Court decision in June changed the legal landscape, saying that higher rates of opioid prescription are not a crime if good faith was intended. The court said prosecutors must prove that a doctor intentionally prescribed the drugs without believing they were medically necessary. Pain advocates hope the decision will embolden doctors to prescribe as they see medically necessary without fear of being prosecuted as drug dealers. The California Medical Board is working to rewrite its opioid prescribing guidelines this year. Medicare and Medicaid in January implemented new billing codes for chronic pain that will allow doctors to spend more time with patients devising treatment plans. The CDC revised its opioid prescribing guidelines late last year. The update seeks to support flexible, individualized pain management that improves patients' pain function and quality of life. The guidelines are not meant to be implemented as a one-size-fits-all policy, she said. Using dose limits in law would be a misapplication. That's a cold comfort to patients like Sandy Masogli, 41, of Manteca, who endures severe migraines, as well as neck and back pain from a spinal cord tumor and cavernous malformation. She said her Kaiser doctor told her in November that she must now have fewer prescriptions. I just white knuckle it, Sandy said. There was a time I started to drink alcohol sometimes, just looking for that relief to quiet my body down. Kaiser is pushing patients to go to the street, she said. We need help and aren't getting it. Even people who are able to get pain meds say they live in fear of having them cut off, and they must go through various contortions to keep them. Many medical guidelines on opioids suggest alternative therapies, but the catch is they're expensive. A lot of us would love to take advantage of other options for pain relief and symptom management, but they are not covered by insurance or aren't funded fully, citing acupuncture, physical therapy, and massage therapy as examples. In the past 5 years, she witnessed other people living with pain losing their access to medication. It's the criminalization of medically necessary treatment.